If you keep on bashing me, I think I will die. Hindi nyo naiintindihan kado ko kayo kamahal. Bawat takbo ko para po sa inyo, hindi para sa akin. Ano ginawa nyo? Binas nyo na ako ng binas. Sobra loob ko. My diagnosis right now is neutropenic sepsis.
Neutropenic sepsis is a life-threatening complication that can occur when the body's immune system becomes significantly weakened due to a reduction in the number of neutrophils, a type of white blood cell crucial for fighting off infections. This condition is most commonly seen in patients undergoing treatments like chemotherapy, particularly in those with cancer, such as sarcoma, where the immune system is already compromised. In patients with neutropenia, the body loses its primary defense against infections, leaving the patient highly vulnerable to bacteria, viruses, and fungi. The term sepsis refers to the body's overwhelming and potentially deadly response to infection. When a person with neutropenia develops an infection, it can progress rapidly into sepsis, leading to multiple organ failure if not treated promptly. Causes of neutropenic sepsis. Number 1. Cancer treatments. Chemotherapy and radiation therapy are the most common causes of neutropenic sepsis. These treatments are designed to kill cancer cells, but also affect the bone marrow, which is responsible for producing neutrophils. With fewer neutrophils, even a minor infection can become severe. Number 2. Bone marrow disorders. Certain conditions like leukemia or aplastic anemia can cause the bone marrow to produce fewer white blood cells, leading to neutropenia and increasing the risk of sepsis. Number 3. Infections. Patients who are neutropenic are highly susceptible to infections, particularly bacterial and fungal infections, which can quickly spread and lead to sepsis. Number 4. Medications. Certain drugs used in the treatment of autoimmune diseases or as part of organ transplants can also suppress the bone marrow, leading to neutropenia and increasing the risk of infection and sepsis. Number 5. Surgery or trauma. Major surgery or injury can also make patients more vulnerable to infections if their immune system is compromised. The immune system in neutropenia. Neutrophils are a type of white blood cell that forms part of the innate immune system. They act as the first line of defense when the body detects a foreign invader like bacteria or viruses. These cells patrol the bloodstream and tissues, seeking out pathogens to destroy. When the number of neutrophils falls below a certain level, the body becomes unable to mount an adequate response to infections, allowing them to proliferate unchecked. The normal neutrophil count is between 1,500 and 8,000 cells per microliter of blood. When this number drops below 500 cells, the condition is classified as severe neutropenia, significantly increasing the risk of life-threatening infections. Risk factors for neutropenic sepsis. Number 1. Age. Elderly patients like Doc.Wellie Ong are at a higher risk because their immune system tends to weaken with age. Number 2. Pre-existing conditions. Those with underlying health issues like cancer, HIV, or autoimmune diseases are at a higher risk of developing neutropenic sepsis. Number 3. Duration of neutropenia. The longer a person remains neutropenic, the greater their risk of infection and sepsis. Number 4. Hospital stays. Hospitalized patients or those with frequent hospital visits are exposed to resistant bacteria and fungi, increasing the chances of infection. Number 5. Environmental exposure. People undergoing chemotherapy or radiation treatment must avoid crowded places and sick individuals as they are highly susceptible to infections. Signs and symptoms of neutropenic sepsis. Neutropenic sepsis can present with a variety of symptoms, but early detection is key to effective treatment. The symptoms can be vague and may initially resemble a mild infection, but they can quickly escalate to a critical condition. The following are common signs and symptoms of neutropenic sepsis. 1. Fever. A sudden high fever, above 38 degrees Celsius or 100.4 degrees Fahrenheit, is often the first sign of neutropenic sepsis. However, in some cases, patients may not develop a fever due to the body's weakened immune response. But 2. Chills and shivering. Patients may experience episodes of chills or uncontrollable shivering, often indicative of the body's attempt to fight off an infection. 3. Fatigue and weakness. General malaise, extreme fatigue, and weakness can signal the body is under attack. Cancer patients like Doc.Wellie Ong may already feel fatigued, so it's essential to monitor any worsening of these symptoms. 4. Low blood pressure. As sepsis progresses, it can lead to hypotension, causing dizziness, fainting, and confusion due to a lack of adequate blood flow to vital organs. Number 5. Rapid heart rate and breathing. An increased heart rate, tachycardia, and rapid breathing, tachypnea, often accompany neutropenic sepsis, as the body tries to compensate for low blood pressure and oxygen levels. 6. Altered mental state. Confusion, disorientation, or even loss of consciousness may occur as the condition worsens and organs like the brain become deprived of oxygen. Number 7. Pale, cold, or clammy skin. As the body struggles to maintain blood flow to essential organs, the skin may become pale, cold, and clammy due to reduced circulation. 8. Pain or discomfort. Patients may report generalized pain or discomfort, particularly in the abdomen, chest, or back. These symptoms can be difficult to distinguish from the underlying cancer-related pain, making diagnosis challenging. Number 9. Difficulty urinating. A reduced urine output or inability to urinate can indicate that the kidneys are not receiving enough blood and may be starting to fail. Early diagnosis is critical to saving the life of a person with neutropenic sepsis. Once neutropenic sepsis is diagnosed, immediate treatment is essential to prevent the condition from becoming fatal. Neutropenic sepsis is a medical emergency that requires prompt and aggressive treatment, especially in cancer patients like Doc.Wellie Ong, who are already immunocompromised. Early detection of symptoms and immediate administration of antibiotics and supportive care can be life-saving. For patients undergoing chemotherapy or dealing with conditions that weaken the immune system, vigilance is key to preventing infections from escalating into sepsis.
Oh, sakit niya. Sakit niya. Sakit ng bukol. I check my WBC. Sabi niya, paano ka nabuhay? Your WBC is 0. If I do not put out this video, I will just die. The news will be, Doc.Wellie died one day. He did not tell his followers. He lied to his followers. May isang basher nagsabi sa akin, Doc.Wellie, even if you run 10 times again and again, you will lose again and again and again. What did I do to you? Why do you hate me so much? Importante choices ninyo. Free will. Maging mabait o hindi. Magpatawad, hindi. Tumulong, hindi. Kung desisyon nyo masama, tuloy-tuloy sa masama. Pati anak nyo apektado. Pag desisyon nyo maganda, mabait, matulungin, I love you all. Dito, Biro. Mahal ko talaga yung tao. Babae natin. Hindi ko pwede sabihin dati. Mukha akong tanga. Sasabihin ko. Pero ngayon may sarcoma na ako. Pwede ko na sabihin.